Hey y'all, it's me Nia and I am back to do my 38-week update. Today is Friday, July the 14th, and I'm officially 39 weeks today, so I'm just recapping last week, which was my 38th week. So let's get into it. Not a lot has changed. I will say that I got everything done because we were hoping and praying that she would come on her daddy's birthday, which was Tuesday, July the 11th. And so yeah, I got everything done and her nursery is pretty much done. We just need a few little knickknacks and all of that kind of stuff. And so I had a little scare, false alarm. I went to the restroom that morning on Tuesday, July the 11th, and went to the restroom, and I thought that my water broke, but I wasn't sure. And I just felt like, you know what, this is too good to be true. Like, she couldn't possibly come today. So I put on a panty liner, and I waited for about 45 minutes to see, you know, what would happen. Went back to check, and there was no fluid. And I was told that if your water breaks, then like if you're not sure if it broke, then to put on a pad or a panty liner and wait, you know, 30 minutes, an hour or so. And she's moving, and then check it again. And if your water broke, then typically you're gonna leak fluid like throughout the time. So there was no more fluid, so it just was, I guess, an extra gush of pee. It just, the way it happened, it caught me off guard, and it wasn't normal, because typically when I go to the restroom, use the restroom and that's it. But I used the restroom and I went to like get up to kind of wipe myself, and another gush came, and I was like, that's odd. And then it was a trickle, and it stopped. And like I said, that never happened to me before. So I was like, that's odd. And that's what made me think, well, maybe my water broke. So let me monitor that, because I know, well, in my hospital, they tell you if your water breaks, they have, I think, 18 to 24 hours to get the baby out before they'll do like an emergency C-section, because they don't want any bacteria, you know, there's a risk of infection because they're not in that sac anymore. So anyway, that was a false alarm. It was not my water breaking. I guess it was just an extra gush of pee. So that was that. Then my sister's birthday was yesterday, the 13th. And so everybody had kept saying, you want her to come? Well, not me. I actually always wanted her to have her own birthday. But everybody, like, my boyfriend was just so gung-ho. I want her to come on my birthday. I want her to come on my birthday. That would be the best birthday present ever. And I'm doing the 21st. It would have been great. It was just 10 days early. So I was like, hey, it is what it is. That's fine. But everybody's like, why, she gonna come on your sister's birthday? She did not come on my sister's birthday. So my brother and my cousin's birthdays are the 17th, which is Monday. So now everybody's like, oh, she's gonna come on their birthday. I just feel like my baby girl wants to have her own birthday. She does not want to share with anybody. And that's just what that is. But we shall see what she decides to do. If I'm making any kind of funny faces, she is really going ham right now, y'all. So just, you know, trying to make it through. So yeah, this week has been very emotional because I have been in a lot of pain and discomfort. I've been saying for the longest, telling y'all how active she is, but it's just like I said, at this point it can be quite painful, especially her hands. I'm assuming those are her hands, down low, and just sending spasms. It can be quite painful. So and I'm just tired of being pregnant, y'all. I'm so tired of being pregnant. Like, I feel like I've been pregnant forever, ever. Like, I'm over it. Like, I want her here. I want to meet her. I want to hold her. And, you know, I know it's selfish of me. She's going to come when she wants to. Ain't nothing I can do about it. But I am just over being pregnant. The back aches, the discomfort, her kicking like now. Feel like popcorn in my belly. It's just so odd. And yeah, so as far as my pregnancy is concerned, medical type thing, so at my appointment on Tuesday, my doctor checked my cervix or whatever. I'm not dilated at all. She did say my cervix was soft, but I'm not dilated. She is head down. And when she told me what position she was in, it made sense as to why I feel the pains that I feel. Her head is down, and she pretty much had me feel where her head is, which is where I thought it was. And then her back let me see if I can stand up and show y'all. So like her head is down here, her back is along here, her butt is up here, and her feet are over here. So I typically feel her feet here all the time or in the middle, and I typically feel lower. I'm assuming that that's her hands. So or I guess, you know, she's in a fetal position, so maybe her feet sometimes, I don't know, but that's where the doctor told me that she is. And so a lot of times I'll feel a whole lot of pressure and pain on my right side, and I think that, and it makes sense because most of her body is over to the right. And when she told me that her back was along that area, it was like, okay, so that's why I feel what I feel over to that side, and that's why I feel her feet. It just made sense as to when I feel her moving. It makes sense as to why, and 99% of the time my belly is lopsided on the right, but knowing that her butt is up there and most of her body is over there, her back, it will make sense as to why I'm lopsided like that. So that was interesting to find out. So yeah, my doctor did say schedule me another sonogram for next week to check on baby girl and see about her average weight, check her amniotic fluid since I'm getting, you know, to the end, and to talk about possibly inducing me. My doctor does not like for her patients to go past their due date, and I'm perfectly okay with that. Like, I'm not that person trying to wait till 42 weeks and all that. Like, I'm over it. And so she definitely won't induce me before I'm 40 weeks, but after that she's like, yeah, if you want to. She's giving me the option. She's not forcing me or anything, but she was like, you know, if you want to, we can schedule something, or you can wait it out and see. It's really up to you. But she was like, she would not let me go into August without having her. So yeah, my due date is the 21st, which is next Friday. And she said the earliest that she would induce me is Monday I think that's the 23rd. Or the 24th, that Monday. So either way, she said that's the earliest, or it can be anytime that week. So I'll be past my due date if I have to be induced. So we're going to talk about that at my next appointment if she hasn't made it. But, you know, like I said, I have not had any contractions. There are 0 signs of labor. Aside from the pressure, you know, she is in position, which is a good thing. She's not breached or anything. But aside from just the pressure, like, I have no signs that labor is near. And like, I googled to see if this was normal, and there were a lot of people that said that they had like spontaneous labor, like there were no signs and then all of a sudden they just had contractions out of nowhere, or mucus plug, water broke, whatever. It just happened. There were like no Braxton Hicks or anything. But I've had one contraction during my entire pregnancy, and I believe I vlogged about it. I think I was like 6 months pregnant, and I was at the mall eating a pretzel, and I had one single contraction, and it only lasted for like 15 seconds. That was it. That's the only contraction I have had this entire pregnancy, nothing else. So it's kind of discouraging because I want her to come out, but she's awfully comfortable in there. So yeah, that's that. Like I said, this week has just been tough because of, I guess, not the anxiety, but yeah, I do have a bit of anxiety about labor, and just like the anticipation, like when is she gonna come? It's to the point where I really want to go back to work. And that was my thing about getting off of my feet, which again, I'm a hairstylist, I'm on my feet all day, and yes, I don't think it's wise to continue to work the way that I was working, but at the same time, it does make me wish that I wouldn't have stopped working, because I feel like if I was at work, I wouldn't be constantly thinking about, oh, is that my mucus plug? Oh, my water breaker? Oh, is she coming today? Is she coming today? Is she coming today? Like, I feel like now that I have nothing to do other than, you know, clean the house and do laundry, I have nothing to do but anticipate her arrival. So I'm actually thinking about maybe going back to work just for a couple hours a day. Like maybe I'm thinking about tomorrow's Saturday, so I thought about maybe going in tomorrow for a couple of hours just to give me something to do, because I'm going stir crazy at home. And yeah, I just need something to do. Like, her nursery is together, her clothes are washed, the bag is packed. There's really nothing else for me to do but to keep cleaning and keep rearranging stuff just for the hell of it. So the only thing that's kind of keeping me from going to work is that just the amount of pain that I'm in sometimes. And it just really depends on where she is and how she's kicking me. Like, a lot of people describe it as discomfort, but for me, like, depending on what she's doing and where she is, it can be painful. Like, it can send spasms, and that kind of thing. Like, I can discomfort, okay, I can deal with that, but the pain sometimes it's just like ridiculous. Well, I'm done up right now because like I said, my sister's birthday was yesterday, so they are throwing her a surprise dinner this evening, and I just wanted to get cute, so I threw on this little sundress, and I got my hair braided for anticipating Jada's arrival. And yeah, I just thought I'll put on some makeup and look cute because I've been looking like a bum all week. And yeah, and so tomorrow my love is taking me on a date night, so we can try to, you know, we've been trying to get our date nights in our alone time before baby girl gets here. So we're doing that tomorrow, so I'm gonna get to get cute tomorrow too. And so he has been amazingly supportive and just trying to keep me sane and keep me from crying. Like, y'all, I feel like I have cried every day this week. Like, let me tell you about today. So today I woke up and I said, you know what? I'm not going to complain I'm not going to complain anymore about being pregnant, or about I'm tired of being pregnant, or rushing my baby out. I said, you know what? I'm just going to take every day, one day at a time, and I'm just going to enjoy these last few days of my pregnancy, of her being inside me. She'll never be in there again. And, you know, when I'm in pain, I'm just going to thank God that she's active and thank God that she's healthy, because her being active and her kicking around lets me know that she's fine. Because if she's not, then that's a problem. So I got on YouTube today and there was a suggested video. I followed these young ladies called, I want to say, My Natural Sisters. I used to follow them or something. I don't know. Anyway, I know that I used to be subscribed. I am subscribed or whatever. And one of the young ladies had a baby. And so her video was suggested. And I was like, oh, she had a baby. So I clicked. And she talked about her labor story. Her baby came early and it was an emergency C-section. And the reason being was because she recognized that her baby was not moving, and she went to the hospital and he was in distress, and come to find out he had lost a lot of blood. And I can't remember the reason why or what happened, but what ticked her off to go to the emergency room, and thank God she did when she did, because they were like, if she would have waited, you know, a few more hours or until the next morning, she could have lost her baby. And so I was just bawling in tears. Well, number one, just because of the story, and she was crying, and I can't watch people cry and not cry. But for two, I just felt so bad. I'm like, here I am complaining that my baby is so active and it's hurting and all of that, when it's people out here that, you know, wish that they felt their babies moving or whatever the case may be. And it's just like, it's crazy. And it just really made me realize that, you know, I need to stop complaining and start being thankful and grateful. And I'm not saying that I can't complain, because shoot, pregnancy is not a walk in the park for everybody. Everybody's experience is different and everything like that. But I feel like I have a right to complain. I mean, if I'm hurting and I'm tired, shoot, I'm hurting and I'm tired. But at the same time, I feel like, you know, I've been trying to change my mindset and my mind frame to be more optimistic and to be thankful, even in those tough times, even in those times where I'm in pain, even in those times where I'm over being pregnant and all of that. Thank God that I've been able to carry her for 39 weeks and that she's okay, and that, you know, she's active and that she's healthy. I thank God for that. And I'm trying not to cry and get emotional, but, you know, I don't think I've said this here, but I've had a miscarriage before. And so experiencing a loss of a baby, and then to go from that to being able to carry your baby full term, or just, even if you can't carry the baby full term, just to have a healthy baby when you've lost one before, or when you know people who cannot carry children or can't have children, or, you know, that kind of thing. It really made me feel bad for complaining about those things. And so it just really made me, this morning I prayed to God. I was like, Lord, please help me in my times of complaining, in my times of pain, in my times of being annoyed and being pregnant. Help me to continue, help me to be optimistic, and help me to be positive, and help me to be thankful in those moments. Because, Yes, it's a fact that it's tiring, it's painful, it's annoying, you're over it, all of that. It does not take away the way that I feel, but at the same time, I'm just trying to change my outlook on it because I don't want to spend my last few days of pregnancy being sad and upset and moping around, because that's what I had been doing. Like, I was just so over it. And my boyfriend was like, he was just like, man, I feel so bad. Ain't nothing I can do. He's giving me massages, he's rubbing my back, but my attitude was just real funky because I was just over it and I felt so discouraged. Like, even now, I'm just giving up the fact that she's gonna come on her own. I just am like, you know what? If they induce me, I'm just and I'm still at that point. I'm like, you know what? Maybe she's not gonna come on her own. I'm just gonna look forward to whatever induction day we set and call it a day. And I'm not being negative in that. I'm just to the point where I don't want to keep anticipating labor. I just want to enjoy it. If she comes, she comes. Lord knows I want her to. But if she don't, we're gonna serve her eviction notice. But either way, excuse me, I'm sorry for rambling. I wasn't trying to, and I know this video probably is way too long. But anyway, that is my 38-week update. Like I said, today marks 39 weeks. So unless baby girl comes before I hit 40 weeks, I will be back to update you guys. Talk to you later.